In this video, we will provide a brief overview of the R.U.S.H protocol. This protocol uses diagnostic ultrasound to rapidly assess a patient who presents with the clinical diagnosis of shock. The evaluation components are divided into three main groups of elements. They are pump, tank, and pipes. It is important to assess the left ventricular contractility to determine the amount of fluid the patient's heart can tolerate during resuscitation. Additionally, poor left ventricular systolic function could very well be the cause of shock. The heart should be evaluated for other common causes of shock, such as cardiac tamponade, pericardial effusion, or pulmonary embolism that may make the pump work inefficiently. In patients who present with shock, it is crucial to know their volume status as well as responsiveness of the inferior vena cava to respiratory excursion. Bedside evaluation of the patient's IVC has been proven to be an effective method of assessing intravascular volume status and also helps determine an approximate range of the patient's central venous pressure. A patient with a dilated, non-responsive IVC is unlikely to benefit from fluid therapy. Ultrasound examination of the abdomen and pelvis can also detect areas of free fluid or blood loss into the peritoneal cavity or other body cavity. Ultrasound of the lung can be used to rule out pneumothorax. With ultrasound, we can diagnose pneumothorax with a sensitivity of 92% compared to CT scan. In addition, an ultrasound of the chest can be performed more quickly than a chest X-ray and has no ionizing radiation. Three major blood vessels should be evaluated. The thoracic and abdominal aorta should be assessed for evidence of aneurysm and rupture of the aneurysm or aortic dissection. Keep in mind that leaking aortic aneurysm may be very difficult to diagnose with ultrasound. The femoral and popliteal vein should be assessed for indirect evidence of pulmonary embolism. Even though the presence of a thrombus in these veins is not proof of a PE, it provides an idea that maybe the patient has had a PE from deep venous thrombosis in the lower extremity.